Okay, Aidan, Carey, this is my child medical assessment. Myself and my partner are called to the home of a 10-year-old who has had a fever for the last few days, and the patient is in bed, and their father called because he is having difficulty waking up for lunch. The patient has been treated with alternating Tylenol and Motrin to manage his fever. Last check this morning was a 101.4 temp, taken under the tongue. So before I get on scene, myself and my partner, our PPE is going to be gloves and a N95 mask. Equipment, we're going to use a jump bag and oxygen, and we're going to consider C-spine. Scene is safe. Primary assessment, as we get on scene, I'm going to check the patient for response to pain. There is response to pain. Airway is patent. Respirations are 24. Lung sounds. I'm going to auscultate the patient, and I find coarse rhonchi in a bilateral basis. SpO2 is 92. Heart rate 126 and thready. Blood pressure 90/40. CTC, I'm going to check the skin. It looks flushed. I'm going to check his temperature. He's hot to the touch. OPQRST, quality of respiration is fast and shallow with above noted sounds. Dad states the child was diagnosed with influenza last week and has been dealing with high temperatures for the last 3 days. And the temperature has been getting higher at night. They have tried several times to put him in a cool shower to help break the fever. So as I look at the patient, I'm going to collect a sample history. I already found that the ABCs, his airway is patent, he's breathing, he has coarse rhonchi, and I palpated for circulation. Sample, the patient is feverish and hot, dry to the skin. The patient has no known allergies, no known medications. And his last medication was Tylenol and Motrin 2 hours prior. The patient also has no past medical history besides flu. Patient hasn't eaten or drinking and has been vomiting, and when he tries to go to the bathroom, he has loose stools. The patient had laid down for a nap and has been woken up by his dad to take a cold shower. So as I see the patient, he's obviously going through influenza. He was already diagnosed with that. So I'm going to give him oxygen just to kind of calm him down. And I'm going to try to reassure him just to calm down, make him comfortable. And I'm going to give him a bag in case he throws up. So my transport decision for this is I'm going to transport with parent consent. And if they do give me consent, I'm going to reassess the patient every 5 minutes due to his CTC and consciousness. As I transport the patient, once we arrive at the hospital, my missed report is I have a child approximately 10 years old complaining of feverish symptoms, and the patient has been diagnosed with influenza a week prior. Patient's symptoms are feverish, vomiting, and loose stools, including high temperatures. Last known temperature was 101.4. The patient had no last oral intake. His last medications were Tylenol and Motrin 2 hours prior, and the treatment given was oxygen and a vomit bag.